Best Home Care Software of 2026. Welcome to part 6 of our 10-part series on the best healthcare software in 2026. In this episode, it's all about home care software, the platforms that support agencies delivering skilled nursing, therapy, personal care, and hospice services in patients' homes. We'll cover what matters as some of the best options for both small and large home care providers. Before we dive in, this video is sponsored by several healthcare leaders, including our title sponsor, athenahealth, as well as our other sponsors and partners, Access Care, NextGen, drchrono, CareCloud, and TotalMD. What a stellar group of platforms. You can learn more about each of them through the links in the description. Alright, let's dive in. What is home care software? Home care software manages the challenges of delivering care in patients' homes rather than clinical facilities. What makes home care operationally different and software selection complex is that the care delivery environment is geographically dispersed. Caregivers and clinicians are mobile, not facility-based. Scheduling is complex and visit-based. Electronic visit verification, or EVV, is now a federal mandate for Medicaid-funded personal care and home health services, requiring GPS-verified clock in and out at the point of care. And billing for home care services has its own coding system, data requirements, and payer complexity. Let's dive deeper into some of the priorities and options for different providers. Best home care software for small agencies. For small home care agencies, whether skilled home health, personal care, or hospice, software is what determines whether the agency runs efficiently or struggles under administrative burden. The wrong system creates scheduling chaos, billing errors, and EVV compliance risk. The best small home care agency platforms handle EVV compliance. Federal and state EVV requirements must be met for Medicaid-funded services. The platform should capture GPS-verified visit data automatically, not through a separate EVV system. Make scheduling manageable. Home care scheduling is complex, matching caregiver availability, patient preferences, geography, and clinical skill requirements. The platform should make this manageable without a full-time scheduler. Support mobile caregivers. Caregivers in the field need a mobile app that works with varying connectivity, allows clock in and clock out, captures clinical documentation, and communicates schedule changes in real time. Handle home care billing correctly. Medicare home health billing, Medicaid billing, and private pay billing have very different requirements. The platform should handle all of them without requiring billing expertise the agency may not have. Prioritize caregiver management. Includes credential tracking, background check status, availability management, and caregiver-patient matching based on skills. Here are several home healthcare platforms consistently chosen by smaller agencies. Note, these are listed alphabetically. Screenshot and return to this list later, then set up demos. There are also links in the description for detailed feature breakdowns in the SelectHub platform, which we encourage you to check out. There you go, some of the best home care software options for smaller agencies. Before we move on, a quick shout out to our title sponsor, athenahealth. Unlike systems that bolt together separate modules, athenahealth, whose Athena One solution provides EHR, practice management, and revenue cycle management, serves medical practices and health systems in one unified system. Their single instance network of over 170,000 clinicians and 117 million patients gives them a scale that's hard to match in ambulatory care. Plus, Athena One is AI native from the ground up. The platform brings AI into the workflows that power ambulatory care, helping practices deliver care, manage revenue, engage patients, and run more consistent day-to-day operations through one connected platform. Thanks to athenahealth for supporting this series. Check them out through the link in the description to see if Athena One is the right fit for your organization. Now, back to the show. Best home care software for mid-market organizations. Mid-market home care organizations like regional agencies with multiple branch offices, multi-service agencies offering both skilled and non-skilled care, and organizations serving multiple payer populations need platforms that handle operational complexity at scale while maintaining the visibility that keeps a geographically dispersed operation under control. Mid-market home care buyers typically look for multi-branch and multi-service line management, centralized oversight of scheduling, billing, and compliance across multiple branches and service types, with the ability to manage each locally, advanced scheduling optimization, algorithms that factor in caregiver travel time, patient clustering by geography, caregiver-patient relationship preferences, and continuity of care to optimize scheduling efficiency. Revenue cycle management, integrated billing with claim scrubbing, eligibility verification, authorization tracking, denial management across Medicare, Medicaid, and private payers, and more. Outcome tracking and quality metrics. Outcome reporting, patient satisfaction data, and quality metrics analytics that support value-based purchasing performance, workforce management, caregiver recruitment, onboarding, credentialing, scheduling, and retention analytics, because caregiver turnover is the most significant operational challenge in home care. Here are several platforms often chosen by mid-market home care organizations. Again, screenshot this list, and there are links in the description for SelectHub's feature-by-feature comparisons and analyst scores. Links to the SelectHub platform are in the description. Best home care software for enterprise organizations. Enterprise home care organizations like large national home health chains, integrated health systems with home care divisions, and programs serving thousands of patients need platforms that can operate at scale while maintaining the clinical quality, regulatory compliance, and financial performance that investors, health system partners, and regulators demand. Enterprise home care platforms need to support enterprise-scale operations management, scheduling, billing, and clinical management across hundreds of locations and thousands of patients, with centralized analytics and decentralized operations, integration with health system partners, bi-directional data exchange with hospital EHRs, post-acute care networks, and payer care management platforms, supporting the care transitions that home care organizations manage daily, workforce analytics and retention, predictive models for caregiver attrition, competitive compensation analytics, and retention program effectiveness tracking, because workforce stability is an enterprise-level strategic concern in home care, regulatory compliance at scale, state license management, Medicare certification compliance, EVV validation, and survey readiness across every state and service line where the enterprise operates. Here are several platforms consistently chosen by large enterprise home care organizations. Screenshot this list and dive into the links for SelectHub's feature-by-feature comparisons. Again, those links to the SelectHub platform are in the description. There you have it, an overview of the best home care software in 2026, from smaller agencies through to enterprise health organizations. For more resources, including pricing guides and SelectHub's database of feature comparisons, check out the links in the description. One more big thank you to the sponsors who made this series possible, including our title sponsor, athenahealth, as well as our other sponsors and partners, Access Care, NextGen, drchrono, CareCloud, and TotalMD. Each of these brings unique value depending on your organization's size, service lines, and payer mix. Links for demos are in the description. I'm Devin Hennig with SelectHub. Thanks for watching, and we'll see you next time. Cheers!